Welcome back. It's been a minute, right? Well, I graduated dental school and allow me to reintroduce myself as Dr. Sameh Soliman. So for the first video back, we did an Instagram live, me and student Dr. Stephen.P.Ray. And we go over the DET exam, the application process, all of the interview do's and don'ts, and we go over the D1, D2 year didactic years. We go over the D3, D4 clinical years. I go over all different types of boards, including the integrated boards, the INBDE, and I go over the state licensures. We go over overall just general advice for dental school, and we give you some words of wisdom. So I hope you enjoy it, and please like, subscribe, comment, share with your friends, and enjoy the show. Thank you.
What's up?
Hello. How's it going?
How we doing?
Good.
I'm Steven. If you don't know me, I make YouTube videos, and I'm a second-year dental student. I'll be a third-year dental student in the next few days. We have our final exam on Monday, so appreciate y'all for being here, for submitting questions. I know that the pre-dental process can be nerve-wracking. It can be confusing. So Dr. Sameh and I are happy to be here to help you and to just answer anything that we can and make this process just a little bit easier for you. So yeah, appreciate y'all for having me.
So thank you guys for joining us this afternoon. My name is Dr. Sameh Soliman. I'm a newly graduated student from ATSU-ASDOH in Arizona. And me and Steven went on YouTube last week, and we did a great session. He interviewed me on his podcast. Do you want to give a shout out to your podcast?
Yeah, it's called Teeth Time. Currently working to add more and more episodes each week. And basically the podcast covers everything around my life. So dental school, dentistry, and a little bit of the creation side and just things that I'm interested in. So it's a good resource. I remember wanting more podcasts when I was a pre-dent. So that's something you can check out. It's called Teeth Time.
Alrighty. And then my channel is DentalLyfe on YouTube, and then also on Instagram. Thank you guys for whoever submitted questions that we're going to go over. So I'm thinking of this Q&A being an hour and a half or so, depending on when Instagram kicks us out. But I'm going to go ahead and read a few of the questions that were submitted ahead of time on the Google form. And then I'll go ahead and give the best answer I can possibly give to some of these questions, and then Stephen will follow through with his input. And then after that, you guys can feel free to, once we give you the cue, to go ahead and post questions in the comment section. You guys are more than free to do that. Okay. So first question that was submitted is, what was your biggest challenge when applying to dental school and completing your D1 year? All right. And followed with, how did you overcome this obstacle? So the biggest challenge that I had applying to dental school was getting in. That doesn't get bigger of a challenge than that, because for me, I got rejected from all of the 19 schools that I applied to the first time, and my stats were not good at all. So I had to do a lot of inspection, for lack of a better word, into my stats and what I have to offer as an applicant, and then kind of improve my application as a whole. So when it came around the second cycle, so I applied 2016, 2017 cycle, and then 2017, 2018 cycle. Second time I applied to 20 schools. I became more selective of the schools that were that I picked, and I ended up putting together a sheet that has all the stats from all the schools, and that was very helpful because it kind of, I used whatever stats I had, and I kind of cross-matched it with the stats for every school, and I saw which school was a good fit for me and which school I was a good fit for. And I think that kind of was very helpful to help me invest my money for the application wisely and not just go ahead and spend it sparingly. Because I applied to Texas school. I'm from California originally, and I thought I was going to get into all the Texas schools. Little did I know they mostly accept in-state people from Texas, kind of exclusively, and it's only like 1 or 2 students out of state. So so kind of pick wisely and have a reason for applying for every school that you apply to. And then as far as the actual D1, the D1 year took a lot of adjustment to get used to, just because of it's not undergrad, it's grad school. We had 3 exams a week. We had exams Monday, Wednesday, and Friday, so it was kind of nonstop. So you just had to find time to study, but also find time to kind of enjoy yourself as a student and kind of hang out with your friends and whatnot. So find time to play, but also find some time to also study. So it's all a perfect balance. And once you kind of get that adjusted as a D1 student, I think you'll enjoy the rest of dental school. So go ahead, Stephen, add your input, please.
Yeah, so in terms of the process of getting in, or applying and getting in, I think that the most difficult part for me was DAT. It was daunting. I mean, I think it was kind of scary for me. I've never been one to be particularly strong at taking a standardized test. And this one was going to include a bunch of science, and I was just not sure of myself. I think when I was going through, I used DAT Bootcamp. I swear by it. I think I wouldn't have been able to even come close to what I did without it. And when I was going through, I noticed that specifically my science scores, which are arguably I would say the most important on your DAT, they were really pretty average, and I didn't think they were going to be good enough. And what I found on test day was that I did a couple points better in every section than I'd been doing on my practice tests. So I went from terrified to pretty excited, elated actually, that I had done that well on the test. Not to say necessarily that the actual DAT was easier. I think my particular one was than boot camp. I think boot camp is a great representation of just the types of questions you can get and the breadth of information. So it was tough for me, but getting that finished and doing well on it was like the biggest relief, I think, other than actually being accepted. And I always, when I talk to pre-dental students, I always want to highlight how important that test really is, because I think it's just the most important aspect of your application. And if you're working on it now, you can use that as extra motivation to spend the long hours that you need to do well on it. As far as D1 year, I think for me, the most difficult part wasn't one specific thing, but it was just adjusting to like learning how to do dentistry. I think at times it can be very frustrating to start using your hands in ways that you haven't before, and you're expected to produce good work, and you're expected to do it and to continue to build on it as you move forward. There's a lot of projects, a lot of checkoffs and things that you have to do. And I think there were definitely times, like the most frustrated I can remember being in last year in my D1 year were related to hand skills. I thought that the studying aspect of it was similar to undergrad, just a lot more information. It was similar to DAT in the amount of information, and it always has been. So that was kind of, I somewhat was familiar with that, but with the hand skills, there were aspects of the lab that just really upset me at the time. What you find though is that everybody improves with practice. And it's the most cliche answer ever, but if you actually go into the lab and just spend time cutting preps, you'll get there. Like everybody will. And that's the way it's been for me. I've noticed genuine improvement, like major improvement in my ability to hold a handpiece and cut on a tooth over the last year, to the point where, like, in the very beginning it would take me 2 hours to do something. Now it maybe takes me 10, and that's only in 2 years of doing it. So I guess the message there is, if you're worried about getting into dental school and struggling with the hand skills aspect of it, just practice and just remain vigilant, because it will come.
To add to your input, one of the perfect sayings I kind of live by is when it comes to dentistry and just other things that you're trying to hop on, whether it's the gym or dentistry or a new hobby that you're trying to pick up on, is perfect practice makes perfect, not just practice makes perfect. So you have to be consistent and perfect what you're doing over and over and over again. And speed will come with time. Don't worry about speed. If you're going to spend 5 hours doing a prep, a very decent prep, by all means, spend 5 hours or even 6 if you have to. But over time, you're going to get comfortable. You're going to get just adjusted to the feeling of the drilling, and it's all in your head, because we as humans, we have a lot of muscle memory. Okay, so it's kind of like riding a bike. So now I've been out of the clinic for about a month, and now I'm trying to get my license to practice in California. And by the time I get my license, it will be probably a month and a half, 2 months since I have touched a handpiece. And I'm not worried about it. I'm going to jump back into it. And same thing with dentists that go on vacation or take a break from practicing dentistry. They come back and they pick up the handpiece, and it's like they never left, because it's all ingrained in your head. It's all muscle memory. So moving on to the next question. How late is late for sending in your applications, dental school applications? So the process of applying, people apply, or the acceptances are determined based on rolling admissions. Okay, so basically first come first serve basis. For me, when I applied the first cycle, I didn't understand the concept of what rolling admission is, and it took me a lot of kind of self-reflecting on the first time that I applied dental school and why I didn't get in, to understand, okay, so it's kind of first come first serve. I need to apply as early as possible. So right now we are June 9th, so the application opened at the beginning of the month, June probably 1st or something like that. That's how they do it every year, and the sooner the better. Some schools, and the document that I put together 2 years ago and I share with pre-dental students that reach out to me, it has a deadline for every school. So let's say UCSF, University of California, San Francisco, their deadline is October 15th. And I just have that memorized because every student that I help, and even myself, I just remember that date because I didn't make that date. So I ended up applying for that school and my DT score wasn't ready. So they ended up rejecting me like October 16th. So it was a waste of my money. So that's what I'm saying. You have to kind of be pre-prepared on how you approach the application, and be conservative with your spending, because it's going to all add up at the end of the day. To answer the question, there is no late time. Like if you apply, let's say post-December, because acceptances are sent out in December 1st, that's going to definitely be semi-late, and you're going to reduce your chances of getting in. But let's say you were on vacation, or you had a lot of graduations during May and June and didn't get a chance to study, and now you're barely starting studying in June, and then you're taking your DT, let's say in September, and I think that is reasonable. As long as like August, September, that's still not late. For me personally, I think that's still considered early, okay? Or earlier than December and whatnot. But the other thing that I'd like to add to this question, or to my answer, is if you are studying for the DT and stressed out about applying, the dental school, all of the admissions don't look at your application because it's considered incomplete without your DET score. So first you need to kind of get the DET in the bag, get that out of the way, and now go ahead and apply after, because that will be considered as a complete application. So you're going to kind of submit the application and kind of forget about it, which is kind of, it's maybe after you submit the DET, God forbids you didn't do well and you do like below average, and you're just devastated and you want to just take an L and apply the next cycle, which again, you understand yourself better than I do. But in that case, you would have by then applied to, let's say, 15 schools and paid for all of them, and now that money is gone. You're not going to get it back because you performed not well on the DAT. I'm not saying that's the case for everybody, but I seen it happen, and I seen it that people took a hit as far as like not doing well on the DT, but also they took a financial hit because it was just not the right way of going about investing their money and the process. So take the DT first. Once you get the unofficial score, go ahead and submit your application maybe the next day or the day of. That is my personal recommendation. Go ahead, Stephen, give your input, please.
Yeah, I think that's really well answered, and I don't have a ton to add. I would just say that if you're waiting to submit your application for any reason other than the DAT, submit it tonight. There's no reason to hold on to it. Get it in there as soon as possible. I originally had my DAT scheduled for like the very end of May because I wanted to make sure that I had my score so I could get the application in by June 1st. And in the process of my studying, I had a finals week and I got off track with my schedule and I ended up pushing the test back, which I would definitely advise being as prepared for the test as possible. So I pushed it back to, I think June 11th was when I took my exam, my DAT. And after I had the whole application written, it was all finished, ready to go. I just got my DAT score and sent the application in, which anytime in this month, I mean, you're on schedule. I think I was invited for an interview sort of late August, maybe around then. And I interviewed either super late August or very early, sorry, not late August, late July, interviewed super early August, sorry. So, but they're going to be interviewing people throughout these next couple of months. It's just really, it helps, especially if you're like an in-state student trying to apply to a school like the University of Tennessee, my situation, it really helps to be one of those first Tennessee applicants that you can get your foot in the door, get that application in as soon as possible, and get scheduled in for an interview. So that's all I would add.
Okay. So there is a follow-up question. Kind of since we're on the topic of the DT, I'm gonna go ahead and just kind of get that out of the way and get that answered. So they say the person that submitted this is, I have finished most of my prerequisites and shadowing hours, but I'm taking the DT in August. Should I apply before then, update my DT score, or just wait and apply after I take the DT? I think we answered that question. But you get the idea, right? That person that submitted the question was on the right track, and they were saying that their #1 school is ATSU-ASDOH in Arizona, my school. And once you get your unofficial scores, some dental schools actually consider that a useful or a tangible score, and they will kind of get your application processed. So once you are done with the DT, get your phone. If you have an iPhone, go on the Notes app and scan the unofficial paper before any tears are shed, whether they're joyful tears or sad tears. Get a picture of it, because I've seen people that crumble it because of they're so upset of how bad they did it. And sometimes the scores are kind of like right borderline acceptable, and you'll never know until you apply. Okay. So make sure you scan that and send it to all the schools that you actually apply to. And some of them will consider it. Some of them have a hard rule that they're not going to accept anything that is not an official school from the ADA. All right. Moving on to the next question. So is it okay if you got all of your shadowing hours from one dentist, or should you move around to other dentists as well? Same with volunteering. Okay. So for me, my recommendation, or like, I have dental assisting experience and I had that for years. Okay. My hard set rule is I want to get as much exposure as I can, whether a dental assistant, whether a pre-dent, whether as a dentist or a dental student. Diversify your experience. Okay. If you're gonna sit by Stephen and assist them for 4 years, sorry, Stephen, but my experience is limited just sitting by your side for 4 years. Okay, because I'm only exposed to what Stephen has been taught over the years. So for me, I worked with general practitioners, general dentists. I worked with specialty, pedo, ortho, everything. So that way, my experience, I know a little bit about everything. And I just kind of added to that knowledge once I got into dental school, once I got through dental school. And I'm also, like, now as a dentist, I'm willing to kind of go and shadow specialists, let's say perio, and see how they place an implant, how they do a sinus lift, because that's something that I want to do as a GP. I can, but they require a lot of training and you need to get certified for it. So for me, I'm willing to put in the time. And I think for you guys as pre-dental students, shadowing and volunteering hours, definitely diversify your application as much as you can. Go ahead, Stephen.
Once again, I agree completely. I think that it helps you both, of course, in your application, but also just in your development as a pre-dental and then eventually a dental student and then eventually a dentist to see more. So much of what we learn in this profession is by seeing the generations ahead of us and what has worked for them and what hasn't. And the more you know, I think that the easier certain things will come to you, especially like in your first year of dental school. Also, committees like to see a devotion to dentistry as a profession, and the more experience you can have in getting out there and seeing things, the better. Some specific advice on shadowing: definitely focus on general dentistry. There's a lot of students who go into dental school and they want to specialize, and that's totally fine. I think if your mind is made up on specializing, try to have a bit of an open mind, because you never know what could happen in dental school. You never know what you might gravitate to. But if you want to specialize, that's totally cool. Don't just go shadow an oral surgeon in undergrad or go shadow an orthodontist. You need to focus on the general dentists and multiple of them. And then if you get to a certain number of hours that you think is sufficient, and I don't have to even have to put a number on that, but you get to a certain point and you want to see some other people, go see some other people. But what you have to understand is that you've got 4 years of dental school, and then if you're going to go into a residency, 2, 4, 6 more years, whatever it is. So you're going to have plenty of time to be exposed to that specialty. What you should be most focused on is, of course, getting into dental school in the first place. And the best way to do that, I've heard it from committee members, we want to see general dentistry shadowing hours, because just to wrap up the question, you have to become a general dentist first before you become a specialist. They want to make sure that you know the principles of general dentistry, and you can work your way around a dental clinic at least a little bit. So that's my advice there.
That is very well put, because like Stephen said, you go to dental school for 3 years or 4 years to become a general dentist. Okay, that is kind of the standard. It's kind of like the baseline model that you're getting, that you're going to get, like cars, and then anything added to that is a specialty or a residency, right? And then for me, you need to kind of learn what it takes to be a general dentist, because if you go and, like, for me, my mind was set on oral surgery. Okay, I wanted to go into oral surgery, and I think, like, I even talked about it in my first application, and that is a big no-no, because again, honestly, admission doesn't care if you want to be an oral surgeon or not. Maybe you got like facial reconstruction and it means a lot to you, and then you talk about it in your personal statement, then that's okay. But if you go from the get-go and tell them, hey, I'm going to dental school for the sole purpose of becoming an oral surgeon, I don't think you're going to have any luck with that type of application, because your ego is getting in the way and you might be coming off as conceited or whatever, but they want to see you, and they want to see how badly you want to become a general dentist. And then dental school, the job of dental school is to teach you all of the specialties and subspecialties of dentistry. And now with an open mind, you kind of gravitate towards whatever specialty you think you are good in. Okay, so let's say in sim clinic, okay, operative, you are just not getting it. Okay, you're barely getting through. Okay, and then endo. Okay, and then after that, your favorite thing is oral surgery, and then you're like the top of the top when it comes to extractions and like bone grafting and all that stuff. Then maybe you kind of reflect on your experience during dental school, and then like D2 or D3 year, kind of talk to your supervisors for that specific specialty and tell them, what do you like and what don't you like about that specialty, and kind of get their input. And tell them, do you think I would be a good fit? Because general dentistry, I don't think I'm cut out for that. Okay, you're surviving dental school, you're getting through the modules, but you're not performing as well as you would hope. Because again, it's a gift. Dentistry is a crafts, it's an arts, it's a gift. And you just kind of work day and night to perfect that gift that you invest a lot of money and time in. So short answer, diversify your experience as much as you can. Next question. Okay, so this is kind of leading up to what we were talking about. So what extracurricular activities did you guys do to get into dental school? So I was talking to a pre-dent this morning, and for me, you can literally write about anything. If you cut hair, if you're a barber, it doesn't matter if you're licensed or not, if you do it kind of a side hustle and you want to talk about it, because again, you're working with your hands and manual dexterity, by all means. If you do knitting, by all means, talk about that as an experience. If you are a mechanic or you like to fix cars or change the oil, that is something, it's very claustrophobic. It's being in a very dark, small spaces. What is the mouth? A dark and a small space. So talk about being a mechanic and what it takes to change oil, because they will love to hear about it. And that's what I'm saying. Like, don't think of any experience as it being too dumb or too stupid. Like, what are they going to say about me? Like, oh, I cut hair and I want to be a dentist. Actually, some of the finest dentists are used to cut hair. And dentistry as a profession back in the day, like so long ago, I don't even remember how long ago, dentistry, you go to the barber to get a haircut and to get your teeth fixed or pulled. So that is how the profession, and that's why some of the dental chairs, like when you go and do the x-rays, they look like barber chairs, because again, it's kind of, it's a very ancient thing. Just fun fact. But yeah, diversify your extracurricular activities, and when in doubt, talk to your mentor, talk to the person that you're shadowing. You can reach to me or Stephen and ask us if you think that this is a good idea. If you can write a paragraph about why you do that certain activity and why it kind of makes for a good manual dexterity, then yeah, by all means, include it in your application. Go ahead, Stephen.
Yeah, so with this, I think everybody is going to be different in how you actually approach this. I guess the best way for me to answer this is just to tell you a little bit about my pre-dental experience. So I was an English major, which was drastically different than a lot of my classmates in dental school. I think most people end up being biology majors or something similar to that. And so I was an English major. I specifically was in a focus within English on technical communication. And so that was specifically looking at like science writing, and we looked at a lot. We were helped in the editing of a journal on nuclear security. So there was all this writing that we were focusing on that was very technical in nature. And in the couple of years that I was in that major, I learned a lot about writing. I learned a lot about communication, written and oral. And so I got into some extracurricular things in my major that I really enjoyed. I helped edit a journal, so I learned about the editorial process. I worked with people in different countries and communicated with them about their writing and things that they could improve on in terms of communicating with people in this country. I also, I entered a writing contest and won an award for a paper. I did a lot of things within my my English major, which I really enjoyed, because I knew that the next 4 years were going to be dentistry, science. So I kind of had this weird little opportunity to learn something different, and I think it really helped me. In addition to that, of course, I did a lot of volunteering, as we all do. It's always important to remember the reason why you're volunteering. Number one, is to help people. Number two, it's to help your chances to get into dental school. So always stay focused on that. But I did a bunch of stuff in terms of volunteering. I for those that don't know, I went to the University of Tennessee in Knoxville, big state school, tons of resources. We had a website specifically devoted to finding service projects. So you just went in there and had like a big calendar, and you could just go through and find all sorts of different things. And it was as simple as that for me. I didn't need dentistry specific service options. You know, it was just anything that I could do to get out in the community. I played bingo with old folks at an old folks home, did that a lot. And that was an interesting and funny experience. And then, you know, I helped set up a science fair and worked with, you know, 6th, 7th grade students on their science fair and things of that nature. So there was a bunch of different things there. Principally, most importantly for me was RAM, remote area medical. I could not recommend going to a RAM clinic enough. If you don't know, these are mobile medical clinics, and they also have dental there as well. And they are wonderful experiences. Dental schools love them. You're basically going to go to a massive free health clinic set up somewhere, you know, in a big building, and you're going to help out with, it can be anything from seating patients to actually assisting either dental students or dentists that are performing free dental care. And that's a wonderful way to both see dentistry and see what it's like, see what the oral healthcare needs of people out there actually are, especially people in certain communities that can be underserved. And then also just getting those dentistry specific service opportunities that you can talk about going into dental school. Some of those experiences, like, in all honesty, from the bottom of my heart, the moment that I knew for a fact that I wanted to be a dentist, like for a fact, was in a RAM clinic. And I talked about that in my personal statement. So go about your extracurricular, your service opportunities with an open mind, and understand that these are life experiences that genuinely might impact the way you think about things and just like the way that your life progresses moving forward. So don't just try to like fly through them with your head down to just like get those numbers. Make sure that you have your eyes and ears open, and you never know like what little specific experience might spark something in you that you can talk about in the future on your personal statement or in an interview and moving forward.
I couldn't agree more with what Stephen said. And the next question is kind of a loaded question. It's a simple question, but it's quite loaded. Discuss the interview process. The interview process is very involved. Every school is different. Every school has its own culture and own criteria that they look for lack of a better word. And they are very selective, okay? But in short, the interview, the reason why you are invited for an interview for the most case is because you look good on paper, okay? And that's kind of the bottom line, all right? So your GPA is good, your DT score is good, your personal statement is good, everything checks off, okay? I want to see Stephen in person. I want to sit across Stephen, whether in person or virtually nowadays, and kind of get to know more about them. And I want to see if what they include in their application is actually truthful, or are they lying. Some people are good at poker faces, some people are not. And they also want to see how genuine you are. Dentistry is a profession that is amazing, and I love any dentist that is genuine about how they approach their staff, how they approach their patients, how they approach their family. It's just all the realm of just being genuine. I think it speaks highly of that person, and that's what they want to see. They want to just kind of get to know a little bit more about you. You might get grilled during an interview, and they might ask you off-the-wall questions, just random questions, just to kind of see how you think on your feet, and you're not going to be prepared for it. There's no like question bank that you can study. And speaking of, there actually are question banks out there. If you just Google sample interview questions, you might find them, okay? But if you sit there and go over them and kind of rehearse it, some dental schools, because again, I talk to people in admissions at different schools and at ASDOH, and their feedback for that specific student, they're amazing. They're just top notch. But during the interview, it was like speaking to a robot. All their answers were prepared and the interview was rehearsed. So there is nothing genuine about that interview. They were like, you know what? That interviewee, that student wasn't genuine during the interview. I don't think they deserve a seat here. And that's why I say, if you find a test bank, kind of just read through them, don't think about it too much, or like, okay, so this is kind of how the questions are structured. Don't really read too much into the question and memorize a specific answer for it, but kind of talk about your life experience, and feel free to ask some questions, because again, it's kind of like going for a work interview. You want to make sure that that relationship or that friendship is compatible, and it's something that's going to last 4 years, and even after dental school you want to maintain that relationship with these colleagues. So it all starts with being genuine. That's my input about the interview process. Go ahead, Stephen.
I agree. I think what he said at the very beginning about every school being different is very true. Our school at the University of Tennessee is it is like shockingly, how do I put this? It's like very comfortable. The people in our admissions department are super cool. They're very down to earth, like to a point where it's like at first it takes you back because you're like, am I really in it? This is like the biggest interview of my life. Like, why are these people so cool? Really was just an opportunity to get to know the person like Dr. Sam was talking about there. And so I think in terms of general advice that I can give you for an interview, is make sure that you're very knowledgeable about your application. You know, because they can like pick and choose. They literally have your application sitting in front of them, and so they'll pick and choose. They'll like point out one specific shadowing experience or surface experience, and they'll ask you about it. So make sure that you're read up on your own life and your own experiences. That shouldn't be too hard. And then just, yeah, please be honest, be genuine. Try not to be too nervous. Like, I know that's something that me sitting here telling you, that's like not probably going to help, but try to just like relax and just have a good conversation. And also realize too that like these might be your future teachers. So think about some of the relationships that you have with teachers in undergrad, or you've had with teachers in undergrad. Some of them, like throughout an entire semester, you get pretty cool with, and you're like, you know, I really appreciate this person. Maybe they wrote you a recommendation letter. And so understand that these interviews, they're all going to be, at least at our school, they're dental school teachers, they're professors on staff. And so they might be some of your teachers that you have D1 year, 2 year in the clinic in the future. And so building those relationships early is actually very helpful, and you can start that in your interview. So that'd be my best advice there.
Yep, I agree with what Steven said. Also, our school, ASDOH, you walk in and I honestly didn't feel stressed because I saw familiar faces. I saw faces that are diversified. So that's kind of like, it didn't make me feel left out. Like there is always like, it's just a culture diversity. And that's why I'm saying like each school is different, because each school is looking for a certain criteria in an applicant, and that's what they want their kind of culture and their legacy to be. And there's nothing wrong with that. It just kind of like, hey, am I going to be a good fit for them, and are they going to be a good fit for me? And I kind of leave it at that. Moving on to the next question. We're going to switch it up. I'm going to let Steven answer this one. So it asks, what is the best way to manage D2 year, since I heard it's the toughest? I will let him answer that, since he's almost done, only a couple days away from graduating D2 year, and I'll add to it, okay?
Yeah, I haven't officially conquered D2 year yet. I have, what, 3 more days?
Yeah,
so I think, yeah, D2 year is 100% more difficult, but it's something that is well within your ability. If you can make it through D1 year, you can make it through D2 year. The reason it's more difficult is not necessarily that the content becomes more difficult, because like, to me, the worst part about dental school from a didactic perspective is the freaking Krebs cycle and biochem and all of that early science that we did. Some of the histology and just learning like every single cell and all of the different unique aspects of it. A lot of that stuff to me was didactically more difficult than some of the things that we learned in the second year. In the second year, you actually learn about the human body a lot more, and you learn about what can ail the human body and how to fix it. And certainly there are things like pharmacology that, you know, you're learning just absolutely countless drugs. They all have crazy names that do not in any way indicate what the drug does. And so that can be very difficult. But I think the reason that the second year is more difficult is just because there's more of everything. There's more lab, there's more coursework, it seems, and then you start to do things outside of lab and coursework that are preparing you for the clinic. And I think this is D2 spring specific, but in your D2 spring, you're going to start preparing to get into the clinic, and you're going to start, at least at our school, you're going to be in the clinic shadowing, helping out. Your role is increasing weekly. You're also going to be learning how to treat a live human, and you're going to do that on each other. So you'll start to take courses about oral diagnosis, the way that we actually would sit down with a patient and diagnose them from day one, how to treatment plan. You'll learn things about taking x-rays and just this entire process. You know, administering nitrous, giving injections, all these things that we do in a dental clinic daily. And that is in addition to your lab work, in addition to your coursework. You know, the lab work increases like 2 or 3-fold in the amount of stuff that we do. Once you get into your fixed and removable prosthodontics courses, you have all of these big major projects to do. So there's just a lot. I mean, it genuinely, it is a lot. I think sometimes it's funny, I look back at the way undergrad was, and it's like, you know, you take, what is it, like maybe 18, 19 hours is a lot for a semester. That'd be like a lot, I guess, right? So in dental school, it's like 26, 27, and it's genuinely, you know, some of those courses are like pretty easy and you don't have to spend too much time on, but you have a lot of big courses that you're constantly taking, and you are constantly just working on the lab and everything as well. So that, all that being said, like, it sounds really scary, but it is entirely manageable. Like, I think it is difficult, but if you take it one day at a time, like, if I can get through it, honestly, anybody can. It's crazy to look back on everything that my class and I have done already in the first 2 years. Like, if I looked at that from the start and said, oh my gosh, I have to do all of this stuff, I would be completely overwhelmed and I wouldn't be able to do it. But now that I've done it, and I took it day by day, week by week, month by month, you know, it's finished. We did it. So that's kind of the way dental school goes, and it's a pretty broad answer. But you know, remain vigilant, keep working hard, and try not to get yourself too overwhelmed. I think a lot of people like myself find a really good balance in dental school. My YouTube channel is a good indication of that. I put a lot of time into my YouTube channel, into my videos, and I wouldn't be able to do that if I was completely swamped, 100% unable to breathe because of dental school. So that should be a good indicator to you that there is still life outside of dental school, and that's an important message that you should all know.
It's all about balance. I call it life-work balance. And if you get anything out of this Q&A / interview, definitely practice that during dental school. Because if you're gonna practice work-life balance, you're not gonna have a life. Okay, that's why I'm calling my name DentalLyfe, is because, again, I enjoy the dental, but I also enjoy just living life and just enjoy just being alive and doing activities other than dental that actually make me happy. YouTube being one of them, and like playing soccer and all that. To answer the question, to kind of follow up on what Stephen talked about, D2 year is definitely the hardest. I think D3 also was kind of hard for me, but so D1 year is adjustment year. D2 year, just toughest year, period. D3 year is the transitional year. Okay, the becoming a dentist year. Okay, D4 year is the becoming a clinician. It's becoming comfortable as a dentist, and it's basically just learning how to do everything way faster by 4th year, because eventually in a couple months you're going to be graduating a dentist. So D2 year, if I give you any piece of advice, is don't let it knock you out. You will fail classes. I did. I failed pharmacology. I failed renal. Unlike what Stephen said about the CREB cycle and all that stuff, our school took that out of the curriculum because the new boards is more clinical based. It's more of case based. So it's irrelevant to, or it's not irrelevant. It's not it's not really, it doesn't add to the concept of becoming a dentist, because anyways, a prerequisite's a biochemistry. So all of the Krebs cycle, all that stuff we learned about in undergrad. So it's just redundant to learn about it in dental school. I rather invest that time learning about business and how to become a practice owner in dental school, like after graduation, and rather than learn about the Krebs cycle for the 100th time. It just that didn't make sense to me, and I'm glad schools are kind of going towards that route. Like, hey, let's teach the dental student that are investing $500,000 in money in their career to actually give them a solid foundational just knowledge on how to become good practitioners. So definitely learn how to adjust by D2 year. And if you try something and that doesn't work, go ahead and try something else. As far as like approaching to study a topic, let's say you studied all the systems in the body a certain way, and then you come and kind of do that same study methods, whether it's flashcards or like uh, uh, what do you call it? Anki notes. I know Stephen did Anki notes and all that stuff. And whether you do that or any other like study methods on notability and whatnot, and that doesn't work for you, if it worked for the systems, and then you go ahead and enroll into the pharmacy class, and it doesn't work for the pharmacology class, overnight, if it doesn't work and you don't do well on the first exam, maybe be open-minded to try a different method and ask your friends, ask your classmates. At this point, I think a lot of dental schools now move towards the pass-fail system, because it's not competitive. You're not really competing for anything. All of you guys got into dental school. All of you guys are going to get through dental school and become dentists. So it's, at this point, help each other to survive dental school, and all of you guys are going to be dentists. So there is a lot, there's plenty to go around. So there's no reason to be competitive. I don't like the atmosphere. It's very toxic. But yeah, so the next question is, we talked about the DT. Yeah, we did. The next question, the one for Tennessee, you want to answer that, Stephen, since you're a little bit more familiar with it?
Yeah, the question is just any tips for incoming D1s at UTHSC. Just because I know that there might only be like one or two of y'all in here, I'll answer this kind of broadly. For anybody who's an incoming D1, make sure that you get into your group me, your class group me, Facebook group, whatever y'all do, and start to communicate with your classmates. Get everything done, like all of the BS, behind the scenes stuff that you have to do, all of the immunizations, all of the forms you have to sign, and just things that you have to get done before you get into school. That should be kind of a no-brainer. Other than that, like, it's funny. It's like you're going to be what? Everybody's going to be in their 20s by the time they get into dental school. You've gone to a lot of different schools throughout your life. So it's funny having that last like first day of school kind of feel as a new student, but like, it's generally speaking, it's gonna be a lot more of the same. Make sure that you've purchased everything that you need to purchase. Don't like freak out and over purchase. That's one thing that just came to mind. Like when we were D1s, somebody would suggest, like one person that was like a D2 would suggest like, oh, I had this one thing that helped. And literally everybody in the class would run out and buy it. Half of us never touched the thing. And like there's specific examples. Like I went out and bought like a $60 tackle box because somebody was like, oh, we use tackle boxes. I literally never, it's just in my closet. It's still got the stickers on it, which sucks. But like, there's just certain things, like you kind of freak out, like you're incoming D1, you want to do everything right. And so you like run out and do everything that everybody suggests. But so definitely don't like over purchase. Understand that like the school's going to, at least by my experience, the school's going to get you set up with everything that you need in terms of telling you what to purchase. Anything in addition to that, you'll discover as you go, like what types of things you need for organization and just all of those things. Yeah, at UT, I think, I don't know if they're making any big changes. I know that our building where we have our lab is currently just completely in a flip-flop. They're doing a bunch of construction and things, so I'm not even sure what the lab situation is going to look like, but just go ahead and get signed up for everything. And if you're really, really super into it, you can start looking at some of the materials. I'm not that type of person. I would enjoy every single last day of freedom that you can possibly enjoy before starting dental school, because once you do, you're in it for the long haul. So that would just be my advice for really any incoming D1.
Go on vacation. Enjoy your summer.
Yeah,
before
please.
You no longer have it.
Do it for Dr. Sameh and I. I know he's been vacationing.
Please.
He just graduated, but like, we want to go on vacation. And if you're not in school yet, please do it. If you have the ability to do that, it is.
You earned it.
Yeah, and it's difficult to do once you get in school. So please try to do some fun stuff.
The a couple of tips as far as D1s go. Okay. So I know a lot of you guys are not going to be going to your home state school. So a lot of you guys are going to be traveling across the country or to wherever you're going to be attending for the next 4 years. I highly recommend you guys stay connected with back home, wherever that might be. Whether it's friends, family, your significant other. You need to have some sort of a groundation. You need to be grounded as a dental student. And that goes for also all pre-health, pre-grad students, because life will knock you out. Dental school will definitely knock you out. You need to have that support system, and you need to have that kind of go-to 5 people, let's say. 5 people that those are your people, those are your go-to people when stuff goes south, because it will. And when it does, you need to kind of have a pre-prepared foundational relationship with those people to kind of fall back on, because they're going to be your support system to kind of keep you afloat during dental school. And then once you graduate, they will be still around, and then do your due diligence to thank them and maybe give them a free crown or something here and there. But yeah, all jokes aside, yeah, I wouldn't be where I am if it wasn't for my support system.
Good answer.
Yep. So we're gonna open the floor. If you guys wanna, I know some questions came through, so if you wanna type in more questions, guys, we're gonna scroll up and then we'll kind of can read them out loud. Let's see. Want to make sure we don't miss anything. So and then all right, Stephen, I like your vlogs. Me too. One mission DMT. Teham, what's up, brother?
My guy, Teham.
I miss you, bro. You're awesome,
get him in
man.
here.
Yes, we have to. Can you do 3-way Instagram live?
Probably.
Okay, maybe next time. Okay. Yeah, he's a must. Let me see. I think we had a good turnout. Okay, so any advice for a D2 student? We kind of answered that. Can I come and shadow you in clinic, Stephen?
That's my clinic partner.
All right, cool. Well, you can't get rid of him then.
I'm stuck with him for the next 2 years. For those that
that's unfortunate, man.
For those that are confused, you do pick a partner in your class, and you will be in the clinic with them for 2 years. And for us, we do a couple of piggyback projects where we'll actually like make a couple, like I think we make one full upper and lower complete denture together for a patient. Mm-hmm. And then you'll also like work back and forth with each other in oral surgery a lot. So there's things like that. So when you get to your late D2 year, you'll pick somebody and you'll work closely with them.
Yeah, speaking of having partners, so one of my mentees, kind of, we touched up on that on the interview on Stephen's YouTube blog, about how you should definitely have a mentee that is a year behind wherever you're at, and someone that is a year ahead of you. So Teham, I look up to him even though he's a year behind me, because the guy is just as motivated as I am, as motivated as Stephen is. And it's kind of those are the like-minded people that you should kind of surround yourself with. And he helped me a lot, and I helped him a lot, and it just kind of goes back and forth, and you grow together through the profession. And then doesn't matter where life takes you, guys are going to be longtime friends, and you're going to see each other during conventions. Hopefully it comes to that point where I meet Stephen in person, hopefully soon.
Y'all will all see it on a vlog when it happens.
Yeah, well, we're gonna be preaching about it. I promise. So Alexis asked a question: are doctors supposed to sign off on shadowing, volunteering, or is there something we record ourselves? I think Veronica answered that. So good job, Veronica. Thank you for answering. I think the majority of the people on here are either pre-dents or D1 students. Let me see. Mo, I miss you, brother. Missing you around clinic, man. GPA. Let's talk about GPA for a little bit. There's no such thing as a good or a bad GPA. I mean, there is a bad GPA. But each dental school kind of has their own criteria and their own cutoff limits. But if you have a quote-unquote bad GPA, the way you can make up for that is go into a master's program and get a master's, and make sure that master's is science related, because the difficulty and how extraneous that master's program is going to make D1 and D2 year way easier for you, okay? And you're going to be spending money to kind of get that master's degree. So you don't want that money to go to waste and kind of like, hey, I'm just going to get a master's degree in like art. Again, nothing is wrong with art, but how is that going to increase your science GPA if that's the one that's low? Does that make sense? Hopefully it does. It's pretty simple. But kind of cater towards the sciences. And I don't know how approachable people that have dental vlogs are on YouTube. I can speak on my behalf and Stephen's behalf. Almost every dental school has a Stephen and a Sameh in their class that have a dental school blog and are accepting incoming pre-dental students with all their questions. So reach out to them and kind of ask them, hey, what should I buy? What do I need as a D1? What should I study for? What is your school culture? Reach out to them. And again, if you don't get a response, you did your due diligence and you actually reached out. But you will never know unless you ask, okay? I think I said what I have to say about the GPA. Well, masters, also you can take science classes at a community college or a university without kind of doing the masters if you really don't want to do the 2-year or 1-year program. But to offset a low GPA, you need to kill it on a DAT. That is probably your safest bet, and it's the least time involved approach, because you can sit down for 3-4 months, study your brains out for DT, get high 20s, and they wouldn't care at that point about your GPA, because GPA is more of a over the past 4 years of undergrad or 6 years of undergrad, this is how Stephen looks like, right? And am I going to judge them over the 4 years? But I also have a kind of a long-term and a short-term. So GPA is more of a long-term evaluation of the candidate, of the applicant. And then the DT is more of a short-term. And one day, this is what Stephen has to offer. And maybe that day was off. Maybe something happened and they didn't perform as well. But I have the GPA to go off of. It's kind of the combination of both. That is what dental schools use to evaluate you as an applicant. Go ahead and add whatever you need to add, Stephen.
Yeah, I mean, I think you explained it really well. The GPA can be very difficult to overcome if you get off on the wrong foot. And so I think that's why what Dr. Sameh is referring to about a master's is so important. I know a lot of my classmates did that. So it's really an effective way to increase your portfolio of dealing with science courses is kind of the simplest way to put it. Yeah, that's really all I would add.
All right, so Ali asked a question. Currently going through a hard time deciding whether or not I should skip my current semester in order to reapply to dentistry. I don't know. I'm not sure I understand the question. I don't know what semester you're in, if you're an undergrad or like a master's program, but feel free to DM me with any more questions and maybe elaborate a little bit more on your situation, either to me or Stephen or both, and we can help you there, Ali. Oh, he asked another question. Okay. The way we do it is here is 1 year pre-dental and 1 year is part-time of your 3 year of bachelor's in either chemistry, biochemistry, or biology. All right, Ali. Yeah, I think your best bet is to reach out to us and then we'll help you there. Veronica asked a question. Do you feel like being a dental assistant before dental school a little easier than classmates who just shadowed? Not sure if Stephen worked as a dental assistant as well. Okay, so Veronica is a friend of mine. I think and I touched base on it on the podcast that we filmed, me and Stephen. I think being a dental assistant for like, I think 8 years before starting dental school, that was like probably the best decision ever. Once I got into the clinic, I killed it. Like I did phenomenal because it's the hands-on, it's being comfortable with the instruments, with the types of procedures. And the best thing is having bedside manners and how to talk to the patient. I worked at front office, back office, dental assistant, lab technician. So any question that the patient asks, I have an answer ready for them because I got exposed to it prior to dental school. So it's kind of that self-built confidence that I acquired over the years, not just as a dental assistant, but just because, again, I exposed myself to multiple positions as a pre-dent and just during my journey, because I knew that dentistry is what I'm going to do. So I wanted to, when I tell a patient like, hey, this is my recommendation, you need an implant on that tooth, they're going to not purchase the treatment plan, but they're going to understand it. They're going to be very well educated, and the acceptance rate of the of that treatment presentation is definitely going to be high because they have faith in me and they have confidence in what I have to offer them. So that's kind of my input about the pre-dentist experience over the years. Go ahead, Stephen.
I didn't work as a dental assistant, but I 100% agree. If I hadn't been accepted when I was accepted on my first application, but if I hadn't been and I was to go back and wait another year, I would have worked as a dental assistant for sure, because just more exposure to dentistry and learning like the specific little things. They may not be like super helpful for D1 year necessarily, because D1 year is like literally just learning how to use a handpiece and learning like the basics of occlusion and things. But the more clinically applicable things that we do, learning how to take a good impression, for example, learning how to very quickly go through a sequence of endo files and measure them and just get them ready to go. Those are all things that assistants do and do frequently. And just everything that he's referring to about working in the back of the office, sterilizing instruments, being familiar with everything that's going to be in a dental office or in a dental clinic, and then also working up in the front and just understanding a little bit more about patients. If you have the time, the opportunity to do it, and it's not going to take away from your grades or anything of that nature, I would recommend it for sure. But I also, that being said, like whenever I make a recommendation like that, I think people hear it and they freak out and they're like, I didn't do that. Am I going to be behind? No, you're not. It's just something extra that you can do if you have that opportunity. And I do think that it would make a pretty big difference, I would say, especially when you get into the clinic, like Sam was talking about.
Ali asked a couple more questions. Ali, I think I'm willing to help you, man. You just got to reach out to us privately, because I'm kind of curious about your situation. And yeah, I would rather do one-on-one kind of consultation. Do you guys mind sharing your dental school stats, DT, GPA? How important are stats in actuality? The Egyptian dentist answered it. GPA is overrated. I agree with that, bro. Yeah, GPA is overrated. As far as stats, I'm an average student, but I'm not an average dentist. That's probably the best way to put it. Because again, the didactics, I really didn't care much for it because any standardized test, really, I'm not hardwired to do well performance-wise on standardized tests, and that's why I took the DT 3 times. But as far as clinically, I think I'm up there, and I'm very confident in my hand skills. So that's kind of what I have to say about that question. Steven, go ahead.
Yeah, I think one thing that I remember specifically about being in the time period that you're all in right now is you're likely all in that, like, I think it's called Dental School Admissions Boot Camp, a Facebook group on
Yep.
Facebook. And like, it is just person after person being like, here's my 27, I just got on the DAT, like, here's my 28, my 25, like, and I remember like I kind of got involved in that early on, and it freaked me out. And I was like, I'm so screwed if this is what people are doing. What you have to understand is that is like a very, very, very small percentage of the population of applicants. And those people, I'm sorry, like if you're one of those people, they tend to just be like flaunting their success and being like, look how good I did, and looking for those comments of like, wow, you did so well. Like, it's not a genuine, I mean, some of them are genuine, I think. Like, some of them are like, okay, here's my experiences. But a lot of them are like, look how good I did. You know, like, so.
Rubbing it in your face.
Yeah, and I would really encourage all of you to not get like wrapped up in that, because it can kind of like deter you from what the focus is, which is that you're an individual and your application is markedly different than everybody else's because you are you. And so, of course, you should be shooting for the highest number possible. Like, I set a number in my head when I was going to take the DAT, and that was like what I was going to get for sure. And I think that's a good practice. But at the same time, like, try to not fall too much into comparing your stats with other people's stats, because it's just not going to be a good representation of your getting into dental school. Like, if you talk to somebody else and they say, oh, I got a 22 and I had a 3.8, you might think, okay, I don't have that. So now you spend these next couple of months like, am I not going to get in? Like, what's going to happen? As opposed to just focusing on like what is in front of you and letting that be. So I just, I know, I understand what it's like to be in that stats grind, but I just encourage all of you to not get too wrapped up in that world.
Speaking on those Facebook groups, I think those people that post those types of posts are soon to be gunners. Kind of keep an eye out for them, because there might be your classmates. So, and I think they already introduced themselves, so you kind of already know who the gunners are in your class. But yeah, I tell my pre-dental students, and again, I've been mentoring pre-dental students for four or five cycles now. So I'm very confident in the advice that I'm giving. And I always tell them to kind of stay away from those forums, because again, if you have a bad score, you're not going to really flaunt it, okay? Unless you're sharing like, hey, this is what I did on the first, second, and third DAT, and this is what I have to tell you. And also, you can easily go like Google Images, like DAT scores, and people post about it all the time, and no one adds their dent pin, and sometimes people cover their name. So I can go on there and I can post, and I'm already a dentist, I can post this just to troll people. And a lot of the people that are on there actually are trolling other students. And I don't know where they get that time from, but they just need to get a life, honestly. Question from Maureen. Is my master's GPA considered separate than my undergrad, or do they average all the sciences? That is a question that I don't know the answer to. I know the answer to most questions, but that is one that I don't. I would say separate because it's a separate program, but I think in the ADEA-AADSAS, if I remember correctly, again, I have a photographic memory, I think there was a section where it had like all of the cumulative science GPA of any science course that you ever taken, whether it doesn't matter if it's community college, university, or a master's program for your bachelor's or the master's. So I think they somehow calculate a composite score for everything, but also they want a standalone GPA from your master's program. Do you know, Stephen?
I don't know, but that would be what I would assume.
Okay. How do I become a dental assistant? Most states have an ROP program, regional occupational program, where you can enroll in. And those programs, basically, they're for, let's say, 8 months to 12-month long programs, and they basically prepare you to become a dental assistant. The best programs are the ones that are free. So if you are a high schooler, or if you're a high schooler, like senior, I think you can enroll in it your senior year of high school. Depends on where you're at, and I think it's covered as, because you're still considered a minor, so it's covered as your tuition is basically waived at that point. But I have some pre-dental students that I'm mentoring from Texas, and there is programs that is sponsored by the Texas Dental Association, and I think it's free if I remember correctly. Reach out to me, whoever asked that question, and I can look a little bit more into it.
Can I add one quick thing to
Yeah,
that?
go for it.
Yeah, so that is a great way to do it. If you're in a small town and you don't want to like go through the formal education of it, there are dentists who will hire people as dental assistants off the street. And like, so my dad, who's a dentist, has done this quite a bit actually. And what will typically happen is they will hire somebody who's like just out of high school or something as a dental assistant, and they won't give them responsibilities other than like sterilizing instruments, flipping operatories, very, very basic things. But what tends to happen is if those people are good employees, they can actually work their way into formal education and become real dental assistants or anything. I think for the purposes of like all of you want to go to dental school, right? So the quicker you can get to that objective, the better. And let's say you're in a small town, or like you have a really good relationship with your dentist, you can always ask like, hey, can I come help out as an assistant in the office, flip operatories, help with the bookkeeping, do whatever it is that they need. That's always something you can ask before trying to go through the full process. But everything that Dr. Sameh just said is extremely valid, and I would use that if you're trying to go about it in the legit way.
So I have a question for you, Stephen. So you said that you didn't get any free or dental assisting experience, and your dad is a dentist. How come? You just didn't want to get exposed to it before dental school?
I didn't go to school in Nashville, which is where I'm from.
Oh,
so
okay.
I wasn't really like home a lot. And
gotcha. Okay, that makes sense.
There were a lot of like the summers is when I did all my shadowing with him and other dentists.
Okay.
And so technically speaking, I did receive a lot of experience just being around the office and like working with his assistants and all those things. I never was formally a dental assistant. Like I've actually done a pretty small amount of assisting. At this point in my career, I've done a lot now because we do a decent bit in school. But like as a D1, I basically had only suctioned a few times, My dad has a great assistant. She's fantastic. She's been with him for many years, and they work really well together as a team. And so like for me to get in there, it'd be really kind of clunky, especially if I'd never done it. So it's the same with other dentists that I shadowed too. It's like I don't even really know them, so you're there to watch. But that would be the reason. Like I didn't have an extended period of time before dental school when I wasn't in school and had that opportunity to work. And I also I think it's something that I would have considered if like I said earlier, if I had extra time and needed that extra kick in my application. But I didn't. That would be the reason.
I think you did just fine, bro.
I think I'll make it.
I think so. Here we are. To add a little bit more on that dental assisting question, I know for a fact the state of California, like don't quote me on it, but If they're still doing it, you can actually get dental assisting experience, again, like fresh off the street, like come in and start assisting, suctioning, and again, not having the duties of a DA or a dental assistant or a registered dental assistant, and like do the bare minimum, which is like sterilization and like suctioning. And over the years, I think maybe let's say 2 years or whatever, you can contact the dental board of California or whatever state you're in and tell them, hey, this is proof that I spent this much time in the profession and I got dental assisting training and I want to test out and become a dental assistant. And you can actually test out. So that way you are getting paid as an employee and you're not actually paying for a program. It just, you are getting paid minimum wage to be a quote unquote dental assistant or pre-dental assistant. Something to consider, but I wanted to just throw that out there. Another question. So I have read example personal statement, and I have found that some talk about their experiences while shadowing. Do you find it necessary to add these into personal statements, given that there is a section 2? I don't recommend you guys talk about that in your personal statement. Talk about it in the experience sections because it's a part of this shadowing experience. And also, if you are asking Dr. Soliman to write a letter of recommendation, you better have an experience section that talks about you being a shadower or a dental assistant with Dr. Soliman. So that way, my letter of recommendation reflects your paragraph that you put onto the application. So that way, when I'm reading the application, it's coherent that, oh, Stephen assisted Dr. Soliman, and that's why Dr. Soliman is writing him a letter of recommendation. And this is what Dr. Soliman has to say about Stephen, the pre-dent. So everything needs to be coherent and everything needs to be fluid in your application. You don't want to raise any red flags and inconsistencies. Anything to add, bro?
I mean, I think the only thing I would say is, and I recently, for those that didn't say, I made a specific video about the personal statement. This seemed like a good time to do it because you are all pretty much working on that. Or a lot of you probably finished with it, but this is kind of the time. The personal statement, in my opinion, is it's a great way to highlight your uniqueness. So I worked with a pre-dental student recently, went in detail with them on their personal statement. And what people tend to do is speak very broadly about like their accomplishments and things they've learned. What I think the personal statement is it's a way to like really stand out and show like what is specific about you and why you want to be a dentist and why you will be a good dentist. And so if there's something that happened in a shadowing experience or a service experience that like blew your mind and changed the way you looked at things genuinely, I would include it. But if it's like, don't just include something. Don't be like, yeah, like I really just enjoyed seeing like people smile again. You know, like that's just, it's a very generic thing. But if you like had a very, very unique and specific experience that changed your outlook on it, that might be something to talk about. So my whole point is just, it is a chance to be unique and to be yourself. And it's not necessarily just a restating or a rehashing of all of your successes and all of the things that you've done.
All right. So next question is, how stressful is the dentist environment? Dentistry can be stressful. It doesn't have to be, but it can be. There's a lot that goes into it. It just, if I give you guys any advice, you need to be calm and collected under whatever circumstances presents itself in front of you. We are a profession where people look up to us, and we need to maintain the professionalism and respect, because your assistants, your employees are also looking up to you. If there's a problem, you need to be addressing it as not the person in charge, but just the figure of authority, I guess, because ranking and whatnot is you're the dentist, you're the one that's supposed to be backing up your staff and looking out for their well-being. Whether it's a rude comment or a racist comment that is mentioned to one of your staff members, you need to kind of address that right there and then, because as much of, like, you can go to any like grocery store or gas station, they say a big sign that says we have the right to refuse service. As dentists, you actually have the right to also refuse service, because if you're going to be disrespecting my staff like that and you're going to be creating a stressful environment for me and my staff, I'm not going to expect that. I'm not going to accept that, and I'm not going to tolerate it. So it's going to be addressed right there and then. But again, all with due respect to that person that is causing the stress, I guess. Go ahead, Stephen.
Yeah, dentistry is and can be very stressful. It can also be great. I will say that it takes the right type of person. I've spoken with people who aren't in dentistry, who are my age, and the thought of like your actions having real ramifications on another human being and their well-being terrifies them, and they're like, I couldn't do that. Most of your friends might say the same thing. In reality, we're not like complete beginners when we actually work on people, so the threat of that happening and being a problem is kind of low. But at the same time, like, you are responsible for people's well-being, which is a great honor, it's a great privilege, but it can be stressful. What you'll find when you get in is you have this internal like judgment system of yourself and the work you're doing, and it can be very easy to get super critical on just the work. If you're prepping a tooth and it doesn't look textbook ideal perfect, you like got the burr out of long axis or something, or you did this or that, and it's easy to get upset, stressed, frustrated. And what you find when that happens is you tend to make the problem worse. So I've found this like interesting thing there. I don't have a name for the phenomenon, but there's this point that I've gotten to in every single specialty in dentistry so far, where I get to a point where this is clinically acceptable, and if I keep working on it, I'm going to mess it up. So I'm stopping. And it is a recognition that you're not always going to get perfection in dentistry, and sometimes getting to a point where this is going to work for the patient, it's going to work for me. It is not textbook perfect. That's what you need, and that's what you can ask for. Certain procedures are more stressful than others, more time consuming than others. But I will say generally, as a dentist, when all is said and done, when you're Dr. Sameh, you're going to have a great deal of autonomy, and it's something that you don't get in a lot of professions. And yes, that comes with a little bit of stress, but it also comes with just, I think, a great life in many ways. You're going to be a lot more autonomous than so many other people, or at least have the opportunity to be at a younger age than a lot of your colleagues in other fields who will be working up through a massive corporation type system for many, many years before they get to the point where they can make decisions about what they do during the day. So just keep that in mind.
To add a little bit on that, because again, the question was very generic, whether like you're a dental student or a dentist, your first job is not your last job, okay, by any means. If it's a job that is the environment or the culture for that company or that doctor that you're working with is causing you stress and making you question everything about life, maybe it's time to quit. Maybe it's time to go where you are celebrated and appreciated for what you have to offer. And that's kind of why, for me, I want to start my own business, because I know what I have to offer, not just dentistry, because again, it's a culture that I'm putting forth to other people out there, whether it's patients or employees or future associates with me. It's something that has the potential for growth, but also something that I'm keeping an open mind, because Stephen, if he comes along, he's going to add to the plate. Not the stress, but he's actually going to take away from my stress. But you need to be screening patients, and you need to be also screening your employees when they come on board. You need to kind of keep an eye on what every person is bringing to what you're offering already. There is the phenomenon, Stephen, that you were talking about. It's the fake it till you make it phenomenon.
Okay. I will keep that in mind.
Fake it till you make it.
It's worked for me so far.
Oh yeah, so far so good. How is the ASDO interview and type and link? So when you go to ASDO for an interview, they're gonna make you sign a waiver that tells you, that basically says that you can discuss questions about the interview with anybody else, and it's basically a contract, and it's just how they operate. But the interview, the structure of it, it's a three set of interviews. It's a traditional interview. Two faculty members are going to be interviewing you, the applicant. It's going to be a group interview where you're going to be interviewed by those same two faculty members, and you're going to be interviewed with a group of, let's say, 5 to 7 people. And it's also going to be MMI, mini multiple interview, or multiple mini interview. I don't know the wording, but you get the idea. MMI. Which is basically kind of scenario based. You're gonna have a scenario posted on the door. You're gonna read it, and behind the door in the room is an actor, and they're gonna act out that scenario. And you're supposed to kind of just be yourself and address the problem at hand. If you want to look it up, it's called MMI. Google it. It's used by a lot of the grad schools. Pharmacy uses it, medical uses it, dental uses it. So there's a lot of resources out there for that. And also, I wanted to touch up on the interviews. There is a concept called the elevator pitch, or the elevator speech. I combined both words. The elevator pitch or the elevator speech. There's also a lot of YouTube videos about that. It's basically, I'm in the elevator with Stephen. I got 10 to 30 seconds to tell Stephen about me, about myself, and what I have to offer, okay? So time yourself, and when you're kind of practicing for the interview, you only have that certain time frame of seconds to basically be coherent and concise about what comes out of your mouth. If you kind of practice that structure, whatever questions are going to be asked for you, to you, you're going to be able to answer it and kind of pin it right there and then, and it kind of frees up space in the interview time for them to ask you more questions and for you to ask them more questions. So that's kind of an interview tip that I would like to share.
Really quickly, Alumnus, we will be saving this. I think Dr. Sameh and I both will upload this to YouTube on our channels if you want to watch it back.
Yeah, it's definitely worth playing back because I know you guys are at different stages of your dental journey, and that's kind of why I wanted to lump sum the getting into dental school and also getting through dental school as a D1, because it's a perfect transition for people that already got accepted that are about to start in a few months. Thank you, Maureen, for talking about the Texas program, dental assistant program. What specific techniques did you use to study? Like, did you read chapters, write notes based on chapters, and then revise them? Do you want to answer that first, Stephen?
Yeah, sure. I think that actually being in dental school has improved the way that I study because it's kind of forced me to. The way that I study now is with Anki. I've made a lot of videos on my YouTube channel about Anki. I always start out by saying that it is not for everybody. I know a lot of people in my class that just straight up have given it a try and just don't like it. For me, like, I think everybody's different. I found for years that I would try to study by like reading through a PowerPoint or making a study guide and then reading through it, and I just didn't retain information. And I think I needed a bit more active participation in what I was doing. And so for me, the answer was a flashcard type of studying where instead of just reading 5 bullet points about a drug or a microbe or whatever it is, I take each of those bullet points and create a question out of them in Anki, of course, and then I go back through and study my cards. And that just for me has been the most effective way that I've found to study. I didn't even start doing that until I was a D1. So I don't really know how I made it as far as I did without that method. I know I had a little bit of success in undergrad with making really, really long and detailed outlines. That's not the word. Like study guide would be a good word for it. like 20-page study guides over all the stuff that we had to know. But the best success that I ever had with those study guides, because what I found was I'd create the study guide, but then like in the creation, I didn't actually learn everything on it. But when I did best was when I actually had my girlfriend hold the study guide and ask me, just flip through the pages to ask me something random. And she would be like, you know, what is this, blah, blah, blah. And I'd be like, I have no idea. And she'd tell me the answer. We flip to something else. What is that? Explain this process. And then and that is active learning. That's active recall. And so maybe that's just how my brain works. I know people in my class that will straight up sit there and rewrite lectures, PowerPoints, and that's just how they learn. They've got that photographic memory. I do not have that. So for you, I would just say experiment with a couple of different things and see what works.
I kind of, for me, I tried Anki, did not like it. It just, again, it's the systematic approach of it, and it's definitely because it's very analytical, it gives you a lot of feedback, and it kind of learns what kind of a student you are, and it kind of caters to that. For me, it was just very involved. I never used it in undergrad. I never used it for the DET. I attempted to use it throughout, like getting into dental school and all that, and even during dental school, and it went over my head. So it's not for me, because actual physical flashcards was never for me. I made flashcards, but by the time I got to that exam, I didn't even have time. I didn't make time to study the flashcards. So I always looked at it as a waste of time, because I invest in the time, but I never get the reward of actually physically studying that content. To answer the follow-up question about the studying for the DET and all that, there are, if you look on Google, like DET bootcamp or general chemistry DET Anki flashcards, there are students that are the Stevens of us, that actually make it and release it and give it to other people to use. So you don't have to reinvent the wheel. There are already content and study guides that exist out there. It just how of a good researcher you are to be able to find that kind of material. Kind of goes back to how much effort you want to put in. But yeah, for me, I invested a lot of time making study guides, but I never went back and reviewed them. And I always kind of kicked myself for it, because it didn't work out. So for me, PowerPoints, taking physical notes, and actually writing out stuff and drawing, because I'm more of a conceptual learner, I cannot memorize anything. I have to understand the whys and the buts and the ifs about everything. That's the student that I am, I guess. Hopefully that answers that question. We answered the specific techniques to study. So for the person from Lucas from Brazil, most of the dental schools in the US are 4 years. There is one dental school, actually maybe two. I think Roseman now it started their 3-year program. Did you know that, Steven?
I did not know that. Actually,
I think they started either the incoming class or the class after that. They're the second school in the US that has a 3-year program.
That sounds tough.
Oh yeah.
I don't know. That wouldn't be for me.
Yeah, tell me about it. Prince of, I miss you, man. Where you been? I haven't heard from you in like forever, Prince of Africa. Hopefully all is well, bro. That's Joshua 1:19. That's how I plan on getting through that. Fair enough. I have a couple. Do you have time for a couple more questions from the list that was submitted, or no?
Sure.
Sure. Okay. And then we'll kind of wrap it up and say our concluding comments, and then get on with our night, man. I know you're finishing up. I'm gonna pick one from there. Do you also want to pick one, and then we'll kind of answer it?
Yep.
Ones that didn't answer already.
For sure.
Yeah. So I'm gonna do one, because I think there is a couple of students here that are dental students. So I want to kind of reward them for being on there. And hopefully it's helpful for them. And also for Stephen, man, this is for you, man. All right, so the question that was asked is, any recommendations for third-party study resources for dental courses aside from Mental Dental on YouTube? So for me, as far as like learning how to cut class 2s or class 3s or how to do a bridge and all that stuff, YouTube has a lot of videos, and every dental school teaches dentistry different approaches, but a bridge is a bridge. It doesn't vary. The dimensions doesn't really vary because it's all textbook. It's all ideal. So and that's what dental school teaches you. The years in sim clinic, practicing on plastic teeth, you learn how to do the standard preparation. So that way, if you get a patient that has a cavity, you learn how to do the standard, and then anything further than that modifies the treatment plan. So definitely YouTube is very good. I think this one Samira asked. Yeah, it was Samira. Talk to students that are ahead of you, either a year or two, and they will tell you how they survived that module or that class and how to get through it. Because again, it's specific for that program, and you need to be making connections and making friends that are upperclassmen. They're gonna serve you very well. She also asked about the timeline for each exam that must be taken throughout dental school licensure board, if they are nationwide or only specific for states. So this one is also for Stephen because he's kind of approaching that. So listen up, mister. So as far as the dental boards goes, okay? So there are the CDCA or the WREB. So actually both of them, so everything about dentistry now in 2022, everything merged, right? It's more of a cohesive examinations in every aspect, whether it's the didactic, the written aspect, or it's the hands-on, okay? By merging, I mean the WREB, the Western Regional exam, and the CDCA, both of them merged. So they're only one exam now. So it doesn't matter where you are in the US, you take that one exam, the combined CDCA and the WREB, and you can practice anywhere in the United States, okay? So that kind of dumbs it down, okay? It simplifies everything. So the WREB and the CDCA, they're hands-on, all right? So they consist of 3 parts, okay? First part, you take end of D2 year, mid D3 year. First part is endo and pros, okay? 2 sections. And the endo pros section, endo is the root canals, pros is doing bridges and crowns, all right? And then the second part, part 2, you take that middle of your 4th year. And then for that specific board exam, you need to do the operative, which is the fillings. You do a class 2 and class 3 filling, and you also do the perio section. So it's operative and perio. So for perio, it's the cleaning. You get also all of them are done on plastic teeth. So because of COVID and all of this stuff going on during the pandemic, state boards, because every state has a dental board that is responsible for making sure everything is good and dandy for that specific state with its anything dental related. Goes back to the higher chains of command, which is the dental board of that specific state. So all the states, I think, or for the most part, many of the states in the US already switched from live patient, which is practicing on a person in a chair, to Manikin based. And you need to kind of check which state accept which type of exam. But the perio and the operative, they're done also on Manikin. You can basically get plastic teeth that have fake calculus that you just flick it off and then you submit and you type it on. So that is part 2 of the hands-on boards. Part 3 of the hands-on boards is the Uthsc. So the OSCE is basically a computer-based examination. I would like to think of it as a pre-boards exam. I highly recommend people to take the OSCE before they take the integrated boards, the INBDE boards, because it's kind of it's a practice exam and it's not that many questions. It's very heavy on pharmacology, and it's also very heavy on oral path. So you kind of take that, it's a confidence booster, you get the score right there and then, and you, in a couple weeks, take your integrated boards. So that is the transition into the written boards, which is the integrated boards, the INDPE. I think it's the INDPE, integrated boards. I want to make sure that I'm getting the, so INBDE. So before this year, it used to be part 1, part 2, and it's for the longest time, that's how it was. But they've been, over the past, I think 10 years, they've been going towards that. And that's why CODA, the committee that approves every dental school to basically have their degree mean something. In the United States, they've been kind of shifting each school's curriculum to be more clinical-based, case-based questions, leaving out the jargon that is like biochemistry and the very particular molecules and all that stuff that you learn as an undergrad. Because again, all that stuff you learn as a prerequisites, as a pre-dental students, you need to be redundant about it during dental school. So they rather have you now learn about the clinical aspects of being a dentist. Hence the INDPE. For that, definitely use Mental Dental and YouTube. And also there is a the website, my DT or not DT, the INBDE Mastery app. That app, if you go on my profile, I have a video. I think it's 10% off promo code. You can reach out for me. You can reach out to me for the promo code. I'll be more than happy to send it to you. But the resources is amazing. They also have an app that you can just practice on the go. And then after you graduate from dental school, the last exam that you have to take is the law and ethics. And that law and ethics is different for every school or for every state that you end up practicing in. So for me, I'm currently unemployed because I haven't had my law and ethics exam in the state of California yet. So I'm studying for that right now as we speak. But that kind of gives you an overview of what exams you need to take leading up to graduation, after graduation. Do you have any questions or comments about this setup, Stephen? Does it make sense? Did I do a good job?
Yeah, that was fantastic. I didn't know any of that, so
crash course. So you're gonna be like tuning in and rewatching this.
You know how it is. Like I just haven't thought about it yet because I'm like I
don't
have to deal with it yet.
Yeah.
But I just learned, like I literally 100% of that was new information to me, so I appreciate it.
So you heard it here first.
Heck yeah.
All right, which question did you end up picking?
I wanted to kind of just address like a couple of them in one answer and just kind of a general. A lot of people asked about like standing out when applying, how to be like authentic and unique in your personal statement. What is the best advice? Like that's a really common one as well. What's the best advice that you could give a pre-dental student? So I'm gonna give a super, like Dr. Sameh just gave like a really in-depth, detailed answer. I'm gonna give a very generic answer. What I've found over the past couple of years is that, at least for me, like this journey into dental school and then getting in and becoming a dental student, so much of it has been me, an inward dialogue with myself about trying to become the person that I want to become. So a lot of you might be like, what does this have to do with dentistry? Dentistry is going to be your life's work, right? But that, like, dentistry is not going to define who you are, but the way that you approach dentistry actually will. It's important that we always remember that we're going into dentistry because we want to be in this field where we interact with human beings and we have the opportunity to take care of other people. And certainly there is there's great financial aspect of it. There are aspects about owning your own business and operating and working with staff, but most importantly, it's people. And so I think what the pre-dental experience to me was an opportunity to ask myself the question, what about myself would I like to improve on, and how can I do that? And a lot of this came after I was actually accepted, but I think it's important to start asking these questions of yourself now. If you see something in yourself, let's take a specific example. Like, say I get on my phone too much. That's something we all probably do. And you want to say, I want to improve upon that. There's a great deal of autonomy that you will find in yourself if you actually approach that challenge and you conquer it and you make a positive change in your life. And what you'll find along that journey is that other aspects of your life become more interesting, become more authentic, become more unique. And in this process, you will develop as a person a unique story. And I just encourage all of you to, a lot of this, it sounds very like general, but appreciate the journey and keep your eyes and ears open at every step, because so many little conversations and moments kind of direct us through our path and can end up being just huge when it comes to our life as a whole. And from like an application perspective, all of these things can be things you discuss in your personal statement and interview. But for me, like I in this process, I've allowed myself to become a big dreamer. And I have like big dreams, goals, and aspirations for my life. And it's really fun and it's very rewarding for me. And I think that all of you can find that in this process as well. And it can be a great motivator for you when you have to study those long hours for the DAT, or you're sitting there, working on your biochem or chemistry in college. The opportunity and the opportunities and just the future that you can have in this profession is very, very exciting. And so I would encourage each of you to really approach each step with appreciation. Understand that this is a blessing, what you're doing. That not a lot of people have the ability or the resources to go into a field like dentistry, and you are embarking on that journey. So appreciate each little aspect of it and try to make the most of it. And when you go in to sit down with someone who is a professor at a dental school, they're going to see like this person genuinely cares about this and they're excited about coming into this field. And that is what it all comes down to. So that when you get to the point where Dr. Sameh is and you're staring your career directly in the face about to begin it, you have all the tools that it takes, and you have your head on straight. Constantly improve. Constantly look in the mirror and say, are there things about myself that I can improve on? There's nothing wrong with that. There really isn't. It's actually a great way to live, because the personal triumphs that you get when you make an improvement in yourself, they feel good, and they keep you going forward. So that's my very general advice. You could take that answer and you could give that to a lot of different people and they could apply it to things that are completely unrelated to dentistry. But that's what I think it's so important to keep that sort of message out there, because that's what I've learned in the past couple of years.
What I'd like to add to what Stephen said is always be a work in progress, and don't be ashamed of yourself not being good enough right here, right now. Always have a positive outlook. Okay, like in 5 months, this is what I'm gonna be. In 6 months, in 7 months, and so forth. In a year, 5, and 10. That's what I want to do, and that's what I aspire to be. Having that forward thinking in life, not just in dentistry, I guess, but having that type of mindset is such a healthy mindset that the only thing that it can do for you, well, it can do a lot of things for you, but one of the most important things it can do for you is open doors, or allow you to open doors for yourself, just because of how your mindset and your thought process is. And for me, if I didn't have that type of mindset, I would have not clicked with Stephen from the first time that I had a conversation with him. And that's why like minds think alike and they're attracted, and it's kind of that like-mindedness that brings people together. And I think that speaks very highly for what we aspire to be as dentists. And it's honestly a great profession. I wouldn't think of myself doing anything else other than dentistry because I would suck at it. And it sucks to suck, to be honest. And dentistry makes me feel alive. It makes me feel like I can do a lot of stuff for myself, but more importantly for others. And it's that giving aspect of dentistry that just is the most rewarding thing in life. Preach. I'm trying to, but yeah, I think we're coming to an end. I'm gonna try to post this on YouTube and I'll send it. I screen recorded it. I think Instagram records it and kind of puts it in your archive to post it. So I'll kind of do that behind the scenes and coordinate with Stephen to be able to post it on our YouTube channels. And if you guys have any questions, please reach out to me on YouTube or Instagram at DentalLyfe. Dental and then Life, L-Y-F-E. And then Stephen, do you want to give your handle?
Yeah, I appreciate y'all for being here tonight. It means a lot to me, and the fact that you're here means that you care and you want to do it. And so that means that you will do it. If you want to kind of like see what I do, my channel, it's Stephen.P.Ray on YouTube, and there's plenty of stuff there. The cool thing about it is that I feel like in the past 2 years, I've really built up a nice portfolio of everything that I do. And so if you ever have a question, I would recommend first like going to my channel and typing in whatever your specific question is, and you're likely to find somewhat of an answer or a long drawn out me blabbering on for a while about it. And then, yeah, you can always message me on Instagram. I'm notoriously bad at responding, but sometimes I do. So if I don't respond, it's nothing personal. I just don't really have a ton of time to get in and give a bunch of really thoughtful answers. But Dr. Sameh does that really well. So yeah, once again, appreciate you all, and it's been fun.
All right, Stephen, you want to put in so that way it's saved in the comments, your handle? Yeah, sure. And then we'll go ahead and close this up so that way you can go about your night. But yeah, once again, thank you guys for tuning in on this first live. And I think there's going to be, I think we had a good turnout, and I would love for us to be able to do it again. Reach out to me with any feedback, whether you liked it, whether you didn't, and anything that we can improve on. But thank you once again, guys. Have a wonderful night. Thank you, Stephen.
Appreciate you, brother. Y'all have a good one.
Bye-bye.